Hello, I'm Dr. E. Barry Gordon, and this is the 22nd video in my series on testosterone deficiency, the medical wonder of our era. It's an extremely serious disease, probably the most serious, yet the medical community rigorously ignores it, allowing essentially the entire population to suffer its effects and die an early death. Today's topic is vascular disease in women, and I'm going to repeat the opening of the video on vascular disease in men. The term vascular disease literally means any of the many and varied diseases that can affect arteries or veins. As it is most commonly used, however, vascular disease refers to arteries being clogged with cholesterol plaques. Although almost any artery can become blocked with cholesterol, the three most common types of vascular disease are peripheral vascular disease, mostly meaning leg arteries and the carotid arteries in the neck, cardiovascular disease, the coronary arteries, and cerebrovascular disease, the arteries in the brain. Clogged arteries in one place generally mean clogged arteries elsewhere. So there is no reason to not believe that if testosterone deficiency predisposes to any vascular disease, it predisposes to all. Since the consequences of testosterone deficiency in women aren't studied nearly as much as in men, there aren't as many supporting medical studies to quote, but there are a few, and they are compelling. This study is from Poland and was published in the January 2003 issue of the International Journal of Cardiology. Their conclusion, quote, "In postmenopausal women, decreased testosterone level is associated with coronary artery disease, independently of other coronary artery disease metabolic risk factors," close quote. A study done in Sweden and published in October 2007 concluded, quote, "Women with cardiovascular disease had lower serum testosterone levels, particularly women using hormone replacement therapy, even when controlled for lipids and other potential risk factors." This Swedish study is interesting for much more than just connecting testosterone deficiency in women with cardiovascular disease. Let me repeat the first part. Quote, "Women with cardiovascular disease had lower serum testosterone levels, particularly women using hormone replacement therapy," close quote. I'm going to discuss another meaning of these findings in more detail at the end of this video. The final three studies all involve carotid atherosclerosis in women, so it's important that you understand exactly what that means. The carotid arteries are the large arteries in the neck that go to the brain. Many people have a Doppler test to check for blockage in these arteries. Atherosclerosis simply means arterial blockage by cholesterol. Among other simplifications, I'm going to substitute the word blockage for the word atherosclerosis during the rest of this video. Johns Hopkins looked at the role of testosterone on carotid blockage in women in a study published in the American Journal of Epidemiology back in March 2002. Quote, "The authors found higher total testosterone to be inversely related to carotid blockage, suggesting its potential importance in reducing the risk of blockage in postmenopausal women not using hormone replacement therapy," close quote. So Johns Hopkins found that the lower women's testosterone, the greater the blockage of the carotid arteries. Another study on this subject was done in Italy and was published 5 years later in March 2007. Their conclusion, quote, "These results suggest a possible protective role of testosterone, at least on carotid blockage," close quote. Yet another study on carotid artery blockage was done in Brussels, Belgium, and was published in the European Journal of Endocrinology in June 2007. They concluded, quote, "The study provides evidence of a positive association between low serum testosterone levels and severe carotid blockage in postmenopausal women. It suggests that higher but physiological levels of testosterone in postmenopausal women have a protective role in the development of carotid artery blockage." So there they are. Studies from Poland, Belgium, Turkey, Italy, and even Johns Hopkins, all finding that testosterone deficiency in women leads to vascular disease. And it's totally, totally ignored. Now, what about that Swedish study that found that the women with cardiovascular disease had lower testosterone levels, especially the women who were using female hormone replacement therapy? Hormone replacement therapy in this context means the female hormones estrogen with or without progesterone. This finding of lower testosterone levels in women using female hormone replacement is strong confirmation of what I discussed in video 8, my disbelief in current medical dogma that indicts replaced estrogen and progesterone as a direct cause of cardiovascular disease in postmenopausal women. Because of the abundant evidence we've seen today showing that testosterone deficiency in women leads to cardiovascular disease and peripheral vascular disease, I'm going to repeat in less detail some of what I said in video 8 because this point is so important to many women's diseases. The production of the reproductive hormones, estrogen, progesterone, and testosterone by the ovaries is controlled by the pituitary gland. This gland sits at the base of the brain and is connected to it by nerve fibers, doing the brain's bidding. The ovaries of a postmenopausal woman are still producing some of the 3 reproductive hormones, but certainly not enough to be healthy. Her brain has reacted to these deficiencies by having the pituitary do everything it possibly can to force her ovaries to work effectively again. Indeed, measuring these markedly increased pituitary hormones is one common way the menopause is diagnosed. The efforts of the pituitary, however, are to no avail. Her ovaries are half dead and cannot respond. Now the woman starts taking female hormone replacement, estrogen with or without progesterone. Her brain senses these replenished hormones, and her pituitary stops driving her ovaries so hard. What happens to the testosterone the ovaries were still producing? Gone. Often these testosterone levels become undetectable. Especially in view of all these studies indicting the lack of testosterone as promoting vascular disease in both sexes, which would simple common sense tell us is more likely to cause cardiovascular disease in women taking female hormone replacement? The reestablishment of previously healthy levels of estrogen and progesterone, or the complete loss of testosterone? I think the answer is as obvious as it's ignored. Visit my website, www.thehiddendisease.com. You'll find dozens of study abstracts, these educational videos, and numerous videos of my patients recounting their experience with testosterone replacement. The next 2 videos will be about congestive heart failure. I hope by this point in the series you all agree with the importance of enabling everyone to learn about this disease of testosterone deficiency and the seriousness of its consequences. Help me in this task. Talk it up. Go out of your way to inform people. Direct them to my website or my YouTube page. Email them the links. Become a fighter in this battle to wake up the public and the medical community to the realities of testosterone deficiency. I'm Dr. E. Barry Gordon. Thank you very much for watching.